Hello and welcome, and a very good evening to our audience. I am extremely sorry, and there are a lot of apologies that I have to give today because this is for the first time that we have started late, almost 6 minutes late from the original time of going live. But there were certain technical issues on the speaker's end, and that is the reason we could not connect earlier. But now, finally, we are live with this topic of ovary burden. It's a topic regarding in which we would be discussing a lot of other gynecological issues. So we have discussed menstruation and other issues earlier, but then we hadn't discussed PCOS, PCOD, fibroids, endometriosis, and all of these topics in our earlier sessions. So we invited one of my childhood friends who was with me during MBBS, and later on she went and became an obstetrician and gynecologist, Dr. Piyusha Wadhwani. She is currently practicing in Lucknow as a consultant obstetrician and gynecologist, and she is also an infertility specialist. So kindly welcome Dr. Piyusha Wadhwani.
Surbi, sorry for the delay.
Hello. Would you like to give the rest of your introduction?
Uh, well, uh, I am Dr. Piyusha.
Okay, is
I,
there another internet issue?
can you hear me? Am I audible?
Yeah.
Hello?
Can you hear me?
Yeah, I can hear you. Can you hear me?
Yeah, I can hear you. Okay. Okay,
Yeah.
so
So,
would you like to give the rest of your introduction? Yeah.
yeah, hi, I'm Dr. Piyusha. I'm a consultant obstetrician and gynecologist. Post pursuing my PG, I did a 1 year fellowship in infertility and minimal access surgeries, and now I'm practicing in Lucknow. Me and my husband, Dr. Devesh, we are running a multi-specialty hospital in Lucknow. So, yeah.
Yeah. So welcome, Piyusha, and
Yeah.
let us start with our session. We are already quite late, so let us start with our
Yeah.
first topic, which is I think the commonest these days. A lot of young girls and a lot of women also have that. That is PCOS and PCOD. So we will first start with the full forms, and then we will move on to PCOS, and then later PCOD.
Sure. Sure. Firstly, the thing is, many people don't know this, but PCOS and PCOD both are one and the same thing. Earlier, they used to be different, but now the term PCOS
Okay, we are extremely sorry. There is definitely some technical issue and some internet error on Piyusha's end. So let us again see whether she can join back. By then, till that time she joins, we can talk about the F1 app that is coming up. So Evrox, as you know, is a healthcare company and it is digital, and that is the reason it has this F1 app, which is going to be launched soon, for which we have been recruiting doctors and nutritionists and other healthcare workers, and especially mental health care workers under the name of the branch Mind Care. So we would like you to watch its demo, and we would like you to see whether you like the app and if you want certain changes before it gets launched. And once it is launched, then you can start with your teleconsultations on it. Okay, I don't know what is happening. Uh, Okay. So I hope there are no more network issues from your end.
Yeah.
Okay. Is the
So,
internet
yeah,
stable now?
yeah, it's stable. Yeah, as I was saying, that
Yeah. Okay.
lot of people don't know this, but PCOS and PCOD are one and the same thing. Earlier, they used to be two different terms, and PCOD was a part of PCOS, but now the term has become obsolete, and both of them are the same thing. PCOD stands for polycystic ovarian disease, and PCOS stands for polycystic ovarian syndrome. So yeah, so what basically happens in PCOS and PCOD? So our ovaries, instead of producing a single dominant follicle, produce many small multiple follicles, and these multiple follicles are basically like they all fight to become a dominant follicle, but none of them is able to become the dominant follicle, and hence they cause difficulty in menstruation, or sometimes they can be reason for infertility also. So that happens nowadays. It is becoming increasingly common. Like 4 out of 10 people are girls are being diagnosed with PCOS, and it is mainly attributed to our lifestyle changes, like eating junk food, sedentary lifestyle, family history. All these things play a vital role. And yeah, to diagnose PCOS, two out of the three criteria should be fulfilled. First is you should have a polycystic ovarian appearance on the ultrasound. Now, polycystic ovarian appearance is like the ovary will have multiple follicles inside, like string of pearls appearance, we call it, something like this. So, either one of the criteria should be this. Other, the patient should have clinical symptoms like amenorrhea, or anovulatory cycles, irregular cycles, or difficulty in getting pregnant, things like that. Unnecessary weight gain, and third is the hormonal levels, like FSH, LH levels are deranged. So any two out of these three criteria, if they are fulfilled, then the person is said to have polycystic ovarian syndrome.
Okay. I couldn't hear the last. Is it what did you say in the last?
I was saying that a female should fulfill at least two out of these three criteria. Should be to be
Okay.
labeled as
Yeah.
diagnosed with polycystic ovarian disease or syndrome. Usually, people just see the appearance on the ultrasound, and then they are like, "कि we have PCOD, PCOS." नहीं, ऐसे नहीं होता है. You should have at least either the clinical symptom or the hormonal level changes and the ultrasound appearance. In तीनों में से at least two should be present.
Correct.
And if
Right.
only the
Correct.
ultrasound appearance is there, then we only label it as PCOM, that is polycystic ovarian morphology, but not
Okay.
PCOS. Yeah.
Okay. That means it just looks like polycystic ovaries, but it's not necessary that you have the disease or the disorder.
Yeah. Yeah.
Okay. Okay. Right. So, what are the lifestyle changes that you would suggest for people who already have been diagnosed with PCOS, PCOD?
See, basically, one of the most common myths that people have is कि अगर if we are fat or if we are obese, fat is a wrong word to say, but if we are obese, and then only we can have
Mhm.
PCOS. But ऐसा नहीं है. Many lean thin patients also have PCOS. So, most common thing which all the doctors say is weight reduction. Yes, weight reduction plays a great role in PCOS. 10% weight reduction बोला जाता है usually. But on top of that, अगर कोई patient lean or thin already है, so for such patients, other important thing is dietary changes. Dietary changes like less of carbs, more of proteins, and less of things like junk food, जो मैदा हो गया, refined flour, sweets, carbohydrates like potato, rice. These things should be avoided. More of green leafy vegetables and fluids, they should be taken. And other than that, at least 1 hour of exercise daily, whatever exercise they feel happy doing. Now it necessarily should not be cardio, or there are people who say कि cardio करने से ही PCOS ठीक होता है, but ऐसा नहीं है. Whatever exercise makes you feel happy, it releases endorphins, it makes you feel happy, it helps in reducing your PCOS symptoms. So basically यही है, डाइटरी चेंजेस है एंड एक्सरसाइज है. आप ये करोगे, वेट लॉस, अगर आपका वेट ज्यादा है, इफ it is required, that will happen naturally. You should not worry about that, and you should focus on your diet and exercise first. And आजकल there are many healthy options, like instead of dairy products, like milk के बदले almond milk you can use, potato के बदले you can use sweet potato in your diet. So flax seeds, all these, they are very healthy options which should be incorporated in a person who has PCOS.
All right. So these are the lifestyle changes
Ragi,
that we talked about. Yeah, yeah.
yeah, yeah, yeah. Complex carbohydrates, basically, not simple carbohydrates.
Okay. So these are the lifestyle changes that you advised. What apart from this would you tell? Because, say for example, lifestyle changes have been made, but what is the rest of the management?
Your question, like, what were you saying? Lifestyle changes have been made, but
Yeah, yeah. So as you have already advised about the lifestyle changes. What
yeah.
else would be the management? What else would come in the management apart from these lifestyle changes that you suggested?
Apart from this, drugs which include myoinositol and dechiroinositol, rather than what I do, rather than going for the hormonal treatment, which is the easier option, we should first try
Mhm.
with these lifestyle changes and non-hormonal treatment, which includes myoinositol and dechiroinositol. बहुत बेसिक ड्रग्स हैं, एंड दे आर वाइडली अवेलेबल all over India, all over world, in different formulations. They can be prescribed for at least 3 to 6 months, depending on the symptoms, and they themselves help in reversing PCOS symptoms. The mood swings reduce, food cravings reduce, the female, she actually starts feeling happier. And when these things happen, apne aap cycles start regulating. And pregnancy bhi, many of my patients have conceived only with these treatments.
Yeah, so basically, coming to this, the major question that people have who have PCOS or who have been diagnosed with PCOD, as you said, they have this concern whether they would get pregnant or not, whether they would face infertility. So, what is your take on this? What is its effect on infertility?
See, PCOS is a very common cause for infertility. That is true, but it's not true that all females who have PCOS will face infertility. है ना. It is an increasingly common cause, but ऐसा नहीं है कि everyone who has PCOS will face infertility. There are patients who have PCOS and who have conceived naturally, and after delivering 2 babies, we find out that कि हाँ PCOS भी है. उसके बाद irregular cycles और ये सब होती है, तब पता चलता है. So it's not like that. As I said before कि एक तो आजकल what, with the increasing awareness, there's lot of wrong information which is also being given. So log, they get diagnosed, they see कि हाँ polycystic ovaries है, firstly they'll assume कि PCO है without getting the tests done or having the symptoms. उसके बाद just because they'll assume they have PCO, they'll be like कि अब हमें बच्चा कैसे होगा, but ऐसा नहीं होता है. Many a times, if you don't worry about it, you will conceive naturally. Other than that, as I told, there are lifestyle management options, there are treatment options which are non-hormonal. उन सब से नहीं हो, and if we are going for infertility, like if we are treating for infertility, Then after getting tests of both husband and wife done, अगर husband का सब ठीक है ये वो and सिर्फ wife का PCO issue लग रहा है, तो उसके बाद we can go with things like ovulation induction. Ovulation induction में we use drugs to produce a dominant follicle, and it has good results. Like सिर्फ you have to take a drug for a few days, कुछ injections वगैरह से, and you conceive. You don't even have to go for IVF. दूसरी चीज which people are not aware about is a technique called IUI. IVF हर गांव के मरीज को, हर किसी को पता होगा IVF टेस्ट ट्यूब बेबी, बट IUI के बारे में लोगों को पता ही नहीं है, and which is a before step. It should be done before we go for IVF in any patient in whose tubes are patent, and if their fallopian tubes are patent, we should first go for IUI, then we should consider IVF.
Okay, so there was another connectivity issue. Yeah, so for the audience's knowledge, what is IUI?
IUI is also known as intrauterine insemination. In that, we give drugs and we produce a dominant follicle. For example, this is the uterus. These are tubes, and these two right here are the ovaries. Now, in IUI, what we do is basically when the dominant follicle is produced, and when it is about to get ruptured, or when it is just ruptured, we will use a catheter which is thinner than the size of a refill, in which we will process husband's semen sperms, and we'll take the active and motile sperms and insert them right here. So this is, as I said, uterus, this is cervix, this is vagina. So we will insert the sperms here. Yeah, we'll insert the sperms here. So what happens is the two advantages happen. One, the semen quality gets improved. Dusra, the distance which the sperm has to cross gets reduced by almost half. So the pregnancy chances double. They double than that of the normal pregnancy chances. They are less than IVF, I agree, but they are double than when the couple stays together naturally. So this
Okay.
I would like to tell everyone, like whoever is trying to have a baby, whoever is struggling to have a baby, if you have gotten yourself tested and if your tubes are patent, you should first go for IUI before considering IVF.
There is some regular connectivity issue. Could you try using some other internet connection or some other hotspot?
Just a second, I'll see.
Yeah.
Is it better now?
Yeah, as of now, it is okay. Let's see while we continue with the session.
Yeah.
Okay. So I think I mean, almost we have given the basic information about IUI. Questions like, okay, so a lot of people ask questions like, you talked about this ovarian induction, right? So a lot of
Yeah.
people do have questions about that as to, yeah, what is induction and how is it done, and also the question which most commonly comes to us is that if they go for ovum freezing, a lot of people want to freeze
Yeah.
their ovum for future
Yeah.
pregnancies, healthy
Yeah.
ovum, if they want to get
Yeah.
pregnant later, or maybe if they want to go for surrogacy later on. So how do they
Yeah.
do that?
See, ovulation induction, I'll show you one thing. Like, this is a patient who is currently undergoing IUI with me. She is undergoing an IUI cycle. So basically बस ऐसे एक chart होता है in which we monitor the follicles. So as I said before, we usually call the patient on day 2 or day 3 of cycle. We use transvaginal sonography and we do see their follicles and see the size of the follicles, and accordingly we induce the patient with drugs so that they produce a better follicle. Like as I said in IUI we are treating the sperm also, treating in the sense modifying, making it, trying to make it better. Similarly, in ovulation induction, we are trying to produce a better quality of an egg, and so we give drugs. Usually it is given for 5 days depending on each patient. Basic dose is for 5 days, and depending on the patient it increases or decreases, and continuously till the dominant follicle is produced. We monitor, we do serial ultrasounds and do the follicular study. And jab the dominant follicle is almost about to rupture or it has just ruptured, two things, either of the two, then we go for either IUI, or if the couple wants to try naturally, we ask them to stay together during those days to increase the chances of pregnancy. So ovulation induction sounds complicated, but basically you just have to take a few medicines. And अगर medicine से नहीं हो रहा है किसी में तो injectables देने पड़ते हैं. But usually teens more than 3 to 4 we don't have to give injections. Usually. Surbi?
Okay. Thank you for that, Piyusha. So moving ahead, let us talk about the major another common issue, that is fibroids. So a lot of people, they encounter having
Yeah.
fibroids, or they suddenly discover that on maybe a general abdominal USG. So what are fibroids, first of all?
Uh, Fibroids are nothing, but they are. Can you hear me?
Yeah, yeah.
Yeah, fibroids are nothing, but they are masses in uterine tissue in the uterus. Basically, they are formed out of the uterine tissue only, and they are present in the uterus or on the uterus like this one. So they are basically benign. Many people think कि they are malignant. No, fibroids are usually benign. And agar if they are not harming you, if they are not causing any symptom like bleeding nahi ho rahi, if they are not on the endometrial lining, and if you're trying to conceive and if they are on the endometrial lining, we need to remove them. But if they are not on the endometrium, and if you're not trying to conceive, or if they are not causing any harm, so many a times it is better ki fibroid is an incidental finding, and if they are just left at that. But if they are causing any discomfort, if they are causing increasing bleeding, pain during menses, or if they are the reason for your infertility, only then we need to get them removed. There is medical management also for fibroid, which can be tried. But usually in patients who are struggling with infertility, we go for surgical option because medical management takes 3 to 6 months at least.
हम क्या कर रहा है? Hello, am I audible?
Yeah, yeah, you are audible.
Okay, okay. So basically, what you're saying is that you don't advise surgical management for people who are having fibroids, but they are not causing any harm to the patient, right?
Yeah,
Do nothing with it
yeah,
and
yeah.
not worry.
We can, we can go for medical management if the patient is anxious,
Okay.
but
Okay.
unless and until if they are not causing any
So,
symptoms.
also the next common question that pops up is that can fibroids become cancerous? Can they become malignant?
No, fibroids do not become malignant, but fibroids do. There is a thing called degeneration. So, very rarely, fibroids undergo degeneration. And basically, the term degeneration, in the sense, what happens with the patient is patient develops severe excruciating pain and intolerable pain, as if like it is a ruptured ectopic, yes, what severe pain. So if patient comes in the emergency with that complaint, then we have to immediately operate it. Other than that, they do not become malignant.
Yeah.
Yeah.
Yeah. Sorry, what did we cover last? Yeah, whether
Fibroid, and
fibroids
do
become
they become
malignant or not.
malignant? Yeah.
Yes, yes. Yeah, so I guess you already answered that. Okay, so moving ahead with our next question, or the next topic, I must say, is endometriosis, another common thing that people want to know about. So, what is endometriosis and what harm does it cause, or what can it change to, convert to in the future?
Endometriosis is basically when the line, the uterine endometrium, like the this is the endometrium, the innermost lining of the uterus. So when the endometrium starts growing in parts other than the uterus, it may be growing in your cesarean section scar. It may start growing in the ovaries. So when it grows somewhere other than the uterine innermost lining, it is termed as endometriosis. When it starts growing in the uterus only but not in the innermost lining, we call it adenomyosis. And when it starts growing in other organs, we call it endometriosis. Now, there is no known reason for endometriosis. There are theories. One of the most commonly believed theory is the Samson's theory, which says that when during each menstrual cycle, the endometrium sheds and regenerates. So the endometrium, when it sheds, instead of, it does come out through the vagina, but some part of it also goes reverse, backflows, and starts growing in other organs. This is the most commonly accepted theory. Other than that, there are genetic factors, like if your mother or sister has been diagnosed with endometriosis, there are chances that you might also develop it. So these two are the most commonly believed, like one theory and the other cause for endometriosis. Endometriosis is also a common cause for infertility. Uh,
Yeah, yeah, I was
it
actually coming to that. That what is its effect on infertility?
Yeah, see, depends. Like if there are people who have अगर एक ovary में, if in one of the ovaries they have endometriosis, usually we call it chocolate cyst or something like that. Chocolate cyst in the ovary, if they have that, they can always produce follicles in the other ovaries, and when that happens they can conceive. And if it is increasing endometriosis, like if it is adenomyosis, and if a patient has symptoms, there are medical managements for it and surgical option for also for it. If patient has chocolate cyst in both the ovaries, then it is better to remove the chocolate cyst and immediately try for conceiving, through IUI or IVF. In such cases, IVF is a better option.
All right. So I think we have almost covered every basic thing, but yeah, but regarding endometriosis, what is the most preferred management when it starts causing a lot of harm to the patient?
Uh, Endometriosis, basically it causes severe dysmenorrhea. What the patient usually presents with is severe pain during cycles. And to
Yeah, because
evaluate.
one of my very close friends, what happened is that she had endometriosis, and one
Hmm.
fine day she literally passed out because of the pain on the floor, and she was almost lying unconscious for 2 to 3 hours when she was taken to the hospital, and then it had probably also spread to her ovaries, and something else had also happened. So yeah, would like to have more insight about that.
So yeah, so when, as I said, you might develop severe pain. So in that cases, दोनों चीजें, we have to treat the pain also and we have to treat the endometriosis also. So endometriosis के there are medical and surgical management depending on the age of the patient, depending on whether her family is complete or not. We either go for either medical management or surgical management. And other than that, what I said was for pain, normal जो होते हैं NSAIDs, ibuprofen, things like that we give. The most common drug actually which is given in endometriosis is dinogestrone. So, but it is better, like, if you consult your gynecologist, depending on your symptoms, if she prescribes which drug to be given and whether you need medical treatment or you should go for surgical treatment.
Correct, right. Okay, so we have covered 2 to 3 major topics today, and they were very important when it comes to the gynecological point of view. Lastly, let's do one session on busting myths. So, what are certain myths that people have about gynecology and gynecological problems? Okay, but
Uh,
first we can take this question: Does or can endometriosis cause cancer?
no, endometriosis does not cause cancer.
Okay. So, yeah, so busting myths. So, let's actually do some myth busting. So, you being a gynecologist, you must have heard a lot of, things people say and they believe in, which are not true. So, let's do one session on myths and facts.
Yeah, see, as I said, for PCOS, people have myths that if you have PCOS, it's necessary that you are obese. That is a myth. Another thing, कि only weight loss से PCOS ठीक हो जाएगा. That again is a myth. It helps, but it is not the only treatment. फिर other than that, कि if you have PCOS, you will have infertility. You cannot conceive naturally. You have to go for IVF. That is a myth. uh, you can conceive naturally. You should try for IUI. If everything fails, IVF should be the option then. And other than that, PCOS को लेके यही myths है. हाँ, PCOD and PCOS are different things. They are the same thing. Other than that, कि ovary में, as I said, ultrasound में अगर दिख गया multiple follicles, so it is PCOS. No, you should have either clinical symptom or uh, lab reports, hormonal levels on top of it. PCOS को लेके तो यही common myths है. And hormonal treatment से ही PCOS ठीक होता है, गलत है. Lifestyle management and non-hormonal medication से it can get cured. फाइब्रॉइड और एंडोमेट्रियोसिस को लेके लाइक वी डिस्कस्ड कि दे कैन कॉज कैंसर, दे आर मैलिग्नेंट, वो दोनों मिथ्स हैं। उनमें भी एज आई डिस्कस्ड अर्लियर कि उनको निकाल, जैसे फाइब्रॉइड है तो रिगार्डलेस ऑफ वेदर इट कॉजिंग इनफर्टिलिटी और एनी अदर सिम्टम, निकालना वो गलत है, यू डोंट हैव टू डू दैट। एंड सेम फॉर एंडोमेट्रियोसिस, लोगों को लगता है कि एंडोमेट्रियोसिस है तो मतलब कैंसर हो जाएगा या इनफर्टिलिटी होगी, नॉट नेसेसरली। सो या इन तीनों टॉपिक्स को लेके तो यही है। अदर देन दैट
Otherwise, also we can discuss. Yeah, yeah. Please go ahead if you want to share something more.
uh, these days usually what I would like to say is patients come to me and like I'm in Lucknow thoda obviously not matlab people are still very shy about opening up to a gynecologist here. They are afraid of the judgment they will face and things like that. So aisa nahi hai. Whenever you are visiting a gynecologist, visit someone whom you are comfortable in talking to, and whatever your doubts are, like females, girls who are unmarried usually feel awkward in sharing their sexual history, and they lie about their sexual history. So that changes the course of treatment. So that is one of the things I would like to request everyone, ki if you are visiting your gynecologist, everyone is under the oath, they won't discuss it or disclose it with anyone else. So you should feel free and share your problem openly. So mostly the senior gynecologists face that more. हम लोगों से तो फिर भी ऑलमोस्ट बहुत ज्यादा एज गैप नहीं होता, तो थोड़ा फ्रैंकली पीपल शेयर, बट जो they hesitate in sharing.
Okay, also now that you broached upon this topic of, being honest about one's sexual history and all of that, there is another question that has popped up, is that how commonly do people want to go for hymenoplasties? I mean, is it that common, and do people really want to, do people really consult gynecologists for that?
Surbi, I can't hear you.
Okay, can you hear me now? Am I audible now? No? Am I audible now?
Yeah, yeah, you're audible now.
Okay. Yeah, so I was asking that, when you broached upon this topic of being honest about one's sexual history to your gynecologist and the other doctors as well in general,
Hmm.
uh,
Hmm.
another question has popped up, which is not kind of flashing here, but the question has popped up, that is hymenoplasty common, and how often do people go for it, and how often are gynecologists approached for such things?
It is quite common. Like it is becoming more common.
Probably more
Usually,
because of a society like India, which is, which concentrates more on a woman being a virgin.
yeah,
So I think that
yeah.
is why it is more
And
common in
where
our
acceptance
society.
is
Do you think
less,
that?
yeah, yeah. It is more common in India, obviously. Abroad, so I don't think like US, UK, anyone would even bother for hymenoplasty. So, but यहाँ पे it is becoming increasingly common. And yes, females do approach us for hymenoplasty. Slowly, the number is increasing. And usually, they come from conservative families or conservative background.
Yeah. So that was my precise question. That, do you think it is more common, like as a gynecologist's opinion, do you think it is more common in a society like India because
Yes, yes,
it concentrates
yes.
more on the virginity of a woman? Yeah.
Yeah, yes, it is. Hmm.
Okay, so on that note, I think I will wrap up today's session. And thank you for coming and
Thank you
sharing your
for having
insights
me.
and knowledge with
Yeah.
the common public. And here are certain comments that have been flashing. Nirmala Auntie is writing good and informative. Pooja Rajpal has written informative session. Devesh has written very informative. Lavishka, both of them, okay, both of them have written insightful. Payal has written good to see you both. Are ha,
Thank you.
Payal has also cleared her gynecology. So yeah, Payal, we'll have
Nice,
another
nice.
session with you next time.
Hmm. Nice, nice. Good. Congratulations.
Okay, so thank you and coming here. And Paramita Bhattacharya says hello, hi, hello.
Hi.
Okay,
Hi. Thank you for having me over.
okay, really informative session. Okay, thank you, Payal. I mean, thanks to Piyusha and thank you for the comment.
No.
So yeah, so Piyusha, any closing comments that you would like to give before I wrap up?
Mm-mm. Nothing. I think you are doing just that you are doing an amazing work, trying to spread awareness in the public and the LGBTQ plus community also. And I feel really proud and happy seeing you do that. I have known you since, I don't know, 14, 15 years now. And it
Yeah,
makes me very proud and happy to see you do that. So just, continue doing the amazing work that you're doing.
thank you so much. Thank you.
Yeah. Okay.
Okay, so wrapping up, we will keep bringing you such speakers who are informative, knowledgeable, and insightful, and they would be sharing more and more knowledge based on various topics. So please like, comment, and subscribe on our channel, and also comment as to what you would like us to cover in the next session or in the upcoming further sessions. And thank you so much, and have a good night.
Bye. Good night.